The following is a presentation of the Healthcare Facilities Network.
Hello, and welcome to the Healthcare Facilities Network. I am your host, Peter Martin, the president of Gosselin, Martin Associates. And as always, I thank you for clicking on our network. I'm pleased to introduce today's episode, which we are calling Team Development and Composition. It's a two-part episode with my guests, Clayton Smith, who's the vice president of facility operations down at Children's Dallas in Dallas, Texas, and Taylor Vaughn, who is one of Clayton's managers down at Children's Dallas. So it's an interesting conversation that we have. I've talked with Clayton a number of times over the years, and we've talked about a number of different areas, from finance to artificial intelligence to the way his philosophy in developing a team, and we thought that this would be a good episode to promote. And it's great to have Taylor on as well, as Taylor reports into Clayton and has for about 4 years now. Taylor has a very interesting path into healthcare facilities management. We talk about that in our very first episode, as we also talk about developing a team. And she talks about how she learned the industry, because she came in from something completely different. And her story is one that I haven't heard before, and that's what I like about talking to people, because you always hear these unique ways that people get in by happenstance, and then they end up falling into a career, which is nice. Taylor is also the president-elect for the Texas Healthcare Facilities Management Association, TAFM, they call it down there. So it's a really good discussion that we have with Clayton and with Taylor. We touch on things from, as I said, developing a team, Clayton's philosophy. He's got a group of managers, Taylor included, who are very young relative to the national average. So he's in a good spot there. He's also fully staffed, which is good. So we talk about that. We also talk about, what if you are a smaller hospital? You know, there's, according to AHA, there's like 6,130, 6,129 to be exact, hospitals in America. 1,800 of those are community rural hospitals or critical access hospitals. Even a larger percentage are community-based, smaller hospitals. So what if you're in one of these smaller hospitals and you're struggling just to attract people? And so I asked Clayton about that in episode 2. What can these smaller hospitals do, and how can they implement a program? So he talks about building relationships, building alliances, how he went about it. And I think that it's instructive, no matter the size of your hospital. Some of the things mentioned by Clayton, I think, can be implemented, and that's what I think gives this particular episode some great validity to it. I was thinking as I was rewatching this episode, as you may know, if you've watched before, I went to Marquette University, a very proud Marquette alum, and back in 1977, when we won our only national championship, which you can see over my left shoulder, the Sports Illustrated cover from that particular title, the coach, Al McGuire, who was a legendary figure in college basketball, they used to call him the philosopher coach, because he had a lot of New York wit and wisdom. Very interesting person from a leadership perspective and a development perspective. But he coined the phrase seashells and balloons. And what he meant by seashells and balloons is something that's pleasant, something that's gentle, walking in your bare feet on dew grass, grass that's loaded with dew in the morning. So seashells and balloons he would use to connote something that was pleasant and enjoyable. And I understand and realize that not all hospitals are enjoying seashells and balloons. It's a tough time out there. Here at the Healthcare Facilities Network, you cover the good, you cover the bad, and you cover the ugly, and you cover the entire gamut. And so it is challenging, and it can be challenging. And so we never want to forget about those smaller hospitals and what can they do to try to implement a program that keeps their people happy, and that keeps management happy, and that keeps leadership engaged. Because those community-based hospitals are just as important as those large, big city hospitals. So anyways, that is the topic of our discussion with Clayton and with Taylor, and so we get into a lot of good nitty-gritty. So I hope you enjoy it. As I said, there are 2 episodes. We are calling it Team Development and Composition, so whether you're a longtime leader or new to the role, I think there's some valuable information in here. So with that, I'm Peter Martin signing off, and we're going to kick it over to my discussion with Clayton Smith and Taylor Vaughn. As always, thank you for clicking on this network. I appreciate it.
here on this call. And it's interesting. You say that like you guys have been in the process for a year, and you hear a year and it sounds like a long time, but then you think about it in those terms. I mean, if you have somebody who's been working there for 35 years, a year, it's not a long time. And I always think like two of the recruitments we were doing, I remember one time a director was telling me he was trying to implement something, and one of his guys, he couldn't type. He didn't know how to type. And he was being very standoffish. And Kevin finally went to him and he wants to do it, but he doesn't know how to type. And, it's not he never was called on to type before. Mm-hmm. And the others, where they were implementing the iPads as a means to do their PMs and their work orders, they were thinking, you're tracking me when I'm in the men's room. So you're using these, and all of that exists, right? And the only way it comes out is over time. It's part of that change management process.
Yeah, I think that's a skill that I didn't learn early. And I'm glad we've developed it, is empathy. Yeah. And being able to kind of take yourself out of, I've got a goal to implement this program in 1 year, and damn the torpedoes, I got to move it forward.
Right.
We've got to sometimes slow down and watch how what we're doing is impacting people. And if that means we got to hit pause and come at it from a different angle, because that these are those type of things that if you do it poorly, you can lose the trust of your team. Right. And it's hard to come back from that.
Well, and I think almost the default these days for people, and I think it's just more societal. I think the default is they're trying to get rid of me. I mean, unfortunately, I think that's most people's default, and your messaging and your actions. I mean, your messaging and your actions, it takes some time over time to. So what do you think? What do you think relative to, like, do you have metrics that you're establishing that you want to get out of this training relative to if we're going to promote, or what are there any that you can share?
So I think I'll speak high level, and then Taylor knows some more of the details. One of the things that we want to get out of this is learning how to create good KPIs. I think the team, as much as we're growing our technician team and our supervisor team, we're relatively young. Everyone is in a growth mode. So you got to kind of learn how to do your job. And then how do you develop KPIs? I need you to learn how to develop KPIs. And that's one of those, I'm giving you an opportunity to go grow yourself. I can tell you what I've always done.
Yeah.
But two things, if you go grow and learn it on your own, you may get to the exact same place I am, and hopefully you're going to find something that pushes that needle just a little bit higher. Right. And I think that's kind of the excitement. You just have to be patient. We're fortunate. Again, we got a lot of bench strength. We got a lot of folks. We're in a growth mode, so we're hiring people.
Are you fully staffed in the facilities department, or
in facilities right now? We are fully staffed.
Are you really?
Yeah.
So you're in a good spot relative to some of your hospital cohorts across the country.
Yeah, we've got some significant growth at a system level. A year from now, we're going to open up an additional 150 beds. So that's going to be a significant growth at that site. We've got other growth opportunities that are as significant as that coming down the pike for us in the Dallas market. So, I think, and all that's been publicized internally. So, the team sees that there's a path, because you can't grow that much physically without growing the team to meet it. Yeah. And I think we're good today. I am very, very concerned with how we're going to recruit. I think the retained people, the retained part, I think we're good with. I think our program is good for that. It's how do you recruit that up for all of this growth that's going to come in the next, 8 years.
Right. Finding people. Yeah.
Yeah. Yeah.
Any thoughts on that, Taylor? Oh, I'm sorry.
No, go ahead.
Yeah, we've talked about several things to recruit people. One of the things that's been kind of circling in my head that I just haven't done yet is getting on TikTok and just doing little short, videos about what healthcare facilities is, especially at a technician level, because people don't know. No. People don't know that career exists. Right. And it's never a dull day. You're never going to be bored. There's always something to do. Yeah. You're always going to be able to have a job. So that's something I've been thinking about and just haven't done. But we've talked about going into high schools and telling them what's, that this career exists, community colleges. TAFLM does a lot with the technical trade schools to get those people who have the skills to come to the hospital instead of the trades first. So a lot of things like that, just making this career known, because a lot of people don't know it exists.
It is. It's so true. We did our first episode of Filling the Pipeline. We had on the part of the group was the people from Massachusetts Maritime Academy, which is right here in Massachusetts, which is where we are located. And they were talking about, even the colleges now are going into the high schools to get, to make people work. Because, if you don't hook them, if you don't hook them sometimes by like their sophomore year of college, they're off because, this career exists. I know this career exists. You're intimately involved on a daily basis. But you talk to anybody outside, there's just not a knowledge that exists yet. We all go into hospitals, like it should be one of the easiest careers to promote if you think about it, because it's so visible. Yeah, it's almost like it's hidden.
Man, that's the thing I get all the time when someone asks me, what do I do? And I say, I work for Children's in Dallas. Oh, are you a doctor? No, there's only about 300 of those, and there's about 7,000 of the rest of us.
Yeah, exactly.
And and being able to exactly promote that what we do, and how big it is and how important it is. That's another place where we're fortunate, is that our hospital administrative team and hospital operations team fully feels that the facilities team is part of the care model. And that's something that I think, the senior person in the facilities group has to be engaged in hospital operations to make sure that that's known, and that we're not just the guys with a screwdriver who can fix something.
Yeah.
That the environment that we create is the environment that those patients get healed in. And you may have great doctors, you may have great clinical staff, but if the environment's not right, they can't be as great as they are, and we're a part of that. And we've been, like I said, we're very fortunate that our team in at Children's is fully aware of that and supports it, and puts us right there in the mix with all of the clinical decisions, so we get to be there, and we're not an afterthought.
I was going to ask you guys that, when you were talking about the program you're developing and the way you go about it, what you obviously need support from above to stay on task and to keep moving forward. And I was going to ask you, do you get that? Do you ever get any pushback from above? But it certainly doesn't seem that way. So what would your support from above has been good?
Yeah, it's been great. Part of that too is how you message it, right? I think in engineering, there's so many of us who grew up with our office next to the boiler plant, down in the dark with no windows. We like to work like that. We like to work in secret.
Right.
And you've got to stop. You got to say that my work is important. And sometimes the daytime out in front of everybody is the right time to do it, because people need to see it happening.
Yeah.
So taking that same philosophy of, we used to do all this stuff, like we would set up training, we would do engineering, we do all that stuff kind of under the radar. And engineering folks or facilities guys, we usually have a pretty sizable expense budget that we can, slush fund a few things in, but just because it costs a lot of money to fix all this stuff.
Yeah.
And you got to be a little more intentional, I believe, to be out in front with your executive leaders. We partnered early with our internal HR and training team. So like all of this training that we're creating, it's all computer-based training, and it lives in our LMS that we use for all of our required annual training. So now that we own it, it's there. They're helping us make sure it's, we're going to review it annually, make sure it's right. But then, all that goes in the employee record. So getting those, having those conversations early, it also gives you a little bit more validity when you go to the executive team and you say, hey, we're going to spend some money to develop this program. HR is already on board with us. We've worked together on this. We've identified these are some gaps, and this is how we're going to move it forward. And getting, having those relationships that allow you to have those conversations, I think is where it's really, really important.
Let me ask a question. As you were talking, I just thought about this. You've worked, you mentioned Moffitt, you were at Moffitt, I think you were at Mayo, you're at Children's, you've worked for really some top-notch healthcare organizations. Taylor, you've been at Children's as well. Let me, you know, the demographic of folks, and this is, you know, some can be crusty, some can not have a lot of money. They can say, yeah, this is great to do it at Children's. But let me just ask, what would so if that person's listening to this, I got no money to do any of this, I have no time to do any of this. But you have to do something. What do you think, what can be done, or what would you suggest to that person who's saying, I don't have time or money to do it? What can they do? And
Yeah.
both of you, both, because you both come at it from different angles. So if you could both answer, I'd like that, if you don't mind.
Yeah, I think I'd love to hear Taylor's answer, but I'll
Sorry,
go
Taylor.
because we see that we've done a lot of presentations at TAFM and at ASHE that you get guys who raise their hand and say, I'm managing the same size hospital you have with 5 people.
Yeah, and you know they're not lying.
Right, and it's hard. Like
Yeah.
I'm sorry. You know, some of it is, you know, not being woe is me.
Yeah.
There's a way. You know, there is a way, and it's not easy. And again, I continue to say over and over, we're very fortunate. But part of that is develop the relationship.
Yeah.
Like, you need to go find, is it your boss? Is it the leader, you know, the head of your HR group? Is it somebody who can help be an advocate for you whenever you go forward and say, hey, this is some money we need to spend. It doesn't have to be a full-blown assessment program with all the built-in tools and all that stuff. You know, sometimes it's, I need one FTE to help, you know, that part of their job is going to be focusing on growth, focusing on identifying new leaders in my group, identifying gaps, identifying how, you know, taking advantage of the free training and making sure people are aware of it. You know, I think one of the things that I've seen a pile of growth in is we highly encourage the CHFM, right? I came to Children's with it. Taylor was the first one in our team to get a CHFM.
Nice.
And super proud of her. And then we had a couple more, and then a couple more. And now we're looking at a single hospital with 7 CHFMs.
Wow.
I think we're up to 9.
Are we at 9?
Out of how many?
Total staff in engineering, 61.
Wow, that's really good.
Oh, I'm sorry. Scratch that. 91.
Well, I'm including Plano, but yeah.
Yeah. So that's 9 CHFMs in a single organization.
Yeah.
I actually called the ASHE, and then they pointed me to the AHA, and I asked which hospital has the most, and they said we don't track it like that. So I did the math, and you know, I could look at the counties that make up the Dallas-Fort Worth Metroplex, and at the time there were 60 CHFMs, and we had 9 of them.
That's pretty good.
And I'm going to say, you know, if no one else can claim it, I'm going to say we have the most.
Right. I don't blame you.
But so going back to your original question, you know, that's a struggle. It's a beating to prepare yourself for and go and take that test. But it's a relatively small cost. But that can become that snowball of
it there, right?
Of if I've gone and grown myself, and then I realize, wow, that was so big. I've got some more gaps I can fill, but now I'm moving into that. I encourage, you know, if you're a director and you don't have a lot of money and you got a manager, let's both go do this. Now both of your eyes are a little bit more open to what the world looks like, and I'm not so focused in the day-to-days of what I have, right? And then, you know, continue to grow. And I think to me, that's really opened the team's eyes to why growth is important, because a bunch of folks take that test and fail. Yeah. And then get back on that horse and let's do it again. Like, now you know that this matters, and this is big. And the pride you feel when you walk away from it, I think, is huge. So if a rural you know, critical access hospital guy says, hey, I don't have any money, I don't have any time for that stuff, start on growing you. Once you grow you'll realize that I can grow my team.
Great. Good advice. Taylor.
Yeah, it's funny because I thought we were going to have 2 wildly different answers, and it's very similar. But I'm going to put my legacy FM hat on for a second, because we were actually talking about this yesterday. What do we do for those hospitals that can't afford it? But I think you need to come in with the mindset of almost a train the trainer approach, kind of like Clayton said. One person's going to go do this, and then they're going to train everybody else. And that's really what I did with the CHFM. I went and did it, and, you know, studied really hard for it for several years. I had a stack of like 400 flashcards that I carried around with me. But once I passed it, everybody else in the department has used those flashcards. They've been passed around, and they're gross now and yellow. But we didn't have to go spend that money again because somebody had already did it. So use that, train the trainer approach. Only one person needs to go learn something, and then they need to pass it on to everybody else.
Yeah. The irony, as you were talking, the irony of what you just said relative to using the flashcards, passing them on. And at the very beginning, you were talking about one of the things you were copying at Office Depot was flashcards.
I know, right?
They weren't the same.
And Clayton's probably like, oh, flashcards. He doesn't like paper. But somebody did create an app. So we have an app too that you can also view the flashcards. But use what you have.
Yeah, you don't like paper, Clayton? Did I hear that?
I have no paper. My computer is not mapped to a single printer.
Really?
None. I don't print anything. And I make a big deal out of it because I feel like it's 2023. We need to stop using paper.
Well, yeah, I mean, back in, I don't know, whenever computers started to get popular, they said there would be no paper used, but well, I give you credit. I mean, I love paper. I like to touch and feel and look. So
I don't even have a pen on my desk.
Really?
Yeah.
Pens everywhere.
Yeah.
I've got them everywhere. So last question is we're coming up to heartbreak. And Taylor, I want to point it towards you. How long, and maybe you can't remember this far back because it was a while ago. I mean, certainly not eons ago, but how long did it take you to start to feel comfortable? Because you're a person who was identified, came in, you didn't necessarily think you'd be doing this, but an untraditional path. How long before you became comfortable and feeling like, hey, this is for me, I can do this?
Really comfortable, and I kind of think of it in my survey realm, like how comfortable I feel during a survey, because that's my main job. But
yeah,
probably 6 years, and that's been through I think probably 15 surveys, and that includes mock surveys. But it wasn't necessarily the time; it was how many times I had gone through it.
Sure.
But yeah, probably 6 years.
And what would your advice be to a person who's finds himself in your position where you were years ago relative to starting off, and what you were accountable for was a pretty important area of the hospital? What advice would you give that person who's struggling, thinking, geez, I don't know if I can do it, or I got to get out of here, or whatever? Obviously you persevered. What would you tell that person?
I kind of think about when the water management plan came out about 5 years ago, and it started to get really popular. And the director at the time, he said, hey, you need to do this. And I didn't know anything about plumbing or water or any of that, but I just kind of had to throw myself into it. And, we talk about money. I didn't really have to spend any money. I just had to go Google everything and, use all the resources on the internet and just learn. You just have to just do the work and learn it for yourself. And, the more time I spent on it, the more comfortable I felt, but it's just going to take time and work and dedication.
Yeah, that's great. It's pretty simple, pretty well said, but really important. Clayton, you're going to say something.
Yeah, I think she brought up a great point. And I think it's something that it takes us so long to figure out that all this stuff isn't magical. It's all written down. like the code is clear. If you NFPA is actually a pretty well written code when it says this is what you should do. And it just takes a long time to realize, it did for me, that the Joint Commission surveyor, he's just done this job for a long time. And he's versed in the code, right? Yeah. You can get yourself versed in the code just like they did. And just being willing to do what Taylor did is said, hey, those resources are available. I'm going to go read them. And I remember I kind of had the same scenario years and years and years ago. My director walked in with the spiral bound Joint Commission hospital accreditation standards and said, you're in charge of EC and LS. Go figure it out. And all of it was written right there. It was hard. It took, you had to get yourself out of, the mindset of it's all written right in front of me. I got to go compare and look at this in the code, and there's a lot of references and things. And you start you're never going to start fully ready, and it's okay.
Yeah,
Right?
exactly.
And I think that's a big message to young people. It's okay not to know it all.
Yeah.
Just get moving. We're here. We're all around you. I remember when I started at Children's, and within 40 days we had a survey. and we
Great
were,
way to learn.
yeah, we walked in the door and Taylor was there with her program, and I said, all right, let's go. If we have findings, we'll have findings. Like we're going to manage this, and we're going to do fine. Like this is a safe place. We're all here, and we're not looking for scapegoats.
Yep.
I think that's being willing to go out there and learn.
Perfect. That is a great way to put a bow on this particular episode. I would like to thank my two guests, Clayton Smith, Taylor Vaughn, both from Children's Health in Dallas. You know, the children's names always throw me for a loop, because sometimes the children's moves around a little bit, but with you guys, it's the distinctive balloon, the red balloon that exists, and that always differentiates. So I would like to thank both Taylor and Clayton from down in Dallas for appearing with me. Thank you both.
Thank you.
Thank you.
I am Peter Martin from the Healthcare Facilities Network. Thank you so much for tuning in today, and have a wonderful day. Thank you for watching this episode of the Healthcare Facilities Network. Please give this episode a like, as it really does make a difference in helping to promote the discipline of healthcare facilities management.